If I had one word to describe the Novartis Health Equity Grant, I would say hope.
In one word, the Novartis Health Equity Initiative means opportunity.
Hi, I'm Amber Dice, CEO, Foundations for Social Change.
My name is Afra Boisevane, and I am Director of Projects here at Foundations for Social Change.
Foundations for Social Change is an innovative solution developer. We're in Vancouver and we work in poverty reduction. And what we want to do is make lasting impact for individuals who are living within homelessness.
The program that is being funded by the Novartis Health Equity Initiative is the research study that we are running in conjunction with UBC, where we are testing the impact of cash and social supports for folks experiencing homelessness.
Homelessness is very often misunderstood. So homelessness, most people think of the individuals who are living on the street that you can see. And that's only about 20% of individuals who are living unhoused. The other 80% are what we call hidden homeless. And they live in cars or abandoned buildings or on friends' couches, and they're very often unseen.
If I could change one misconception that we all have about homelessness, it would be that everybody, you and I, we are all far closer to being homeless than we are to being a millionaire or a billionaire.
And they've just had a few dominoes fall in their lives that's created a crisis situation or moment in time. So at the time that we found out that we'd won the grant, Foundations for Social Change was at a real pivotal point where we weren't sure if we're going to be able to move forward and continue helping people. And when I opened the email that we'd received the grant when we won, the feeling was joy and hope.
There are two things that make our study unique. The first thing is our community connectors. They are folks with living and lived experience who are present to support our participants. They are incredibly compassionate. They have super strong boundaries, and they make a world of difference for people who feel like they have really reached the end of the line.
The New Leaf Project is a program where we are providing individuals with cash and wraparound supports and following them for a 12-month period.
One of the proudest moments that I've had when I received a phone call from a participant, I was the person that they told what was happening so that someone out there would know that they were safe. They called and they told me that my presence and the phone that we provide through the study was the single thing that prevented them from walking into the mountains and never returning.
Public perception is that they'll waste it on drugs or alcohol or cigarettes or gambling, and really our research shows the opposite.
The work that we are doing here at FSC is common sense work. We see that folks have a need and we fill that need. And it feels like it should be simple, but because of stigma, because of this preconceived notion of what it means to be homeless and how somebody ends up in this position, it is hard to fight for funding.
One of the other really important pieces of the Novartis grant has been that being connected to an organization like Novartis has given us a lot of legitimacy and has given us a lot of opportunity to tell our story in a different way.